Good morning. I'm going to talk about pulmonary edema. Pulmonary edema is a fluid accumulation in the air space of a parenchyma of the lungs. It leads to impaired gas exchange and may cause respiratory failure. It is due to either failure of the left ventricle of the heart to adequately remove blood from the pulmonary circulation or an injury to the lung parenchyma or vasculae of the lung.
Pick up is the fact that the lungs are generally a little bit denser than normal. They're not quite as open and aerated as you would expect to see. Perhaps it would appear that these lungs could very easily be very acutely congested. In addition, if we had the advantage of actually looking at these lungs, we could see that
Treatment focuses on three aspects. Firstly, improving respiratory function. Secondly, treating the underlying cause. And thirdly, avoiding further damage to the lung. Pulmonary edema, especially in the acute setting, can lead to respiratory distress, cardiac arrest due to hypoxia, and death. Symptoms and signs: difficulty breathing, coughing up blood, excessive sweating, anxiety, pale skin, short sense of breath, and other signs of respiratory crisis. Cause: left ventricle failure may be due to a heart attack leading to arrhythmias, hypertensive crisis of body obstructions, neurogenic cause, inhalation, or hot or toxic gas, pulmonary contusion, high energy trauma, re-expansion, repercussion injury, immersion pulmonary edema, and multiple blood transfusions.
First, basically, you want to start off with the cardiac probe, although you can use also the abdominal probe, and start off on the anterior part of the chest on either side. Typically, you can go mid-clavicular until you actually see the profile that you want. Again, you're going to be looking for the bad side or two ribs, rib shadows that flank lung tissue. You're going to identify the pleura itself with a hyperechoic line, and then typically with pulmonary congestion, ERDS, any kind of process that's going to flood the alveoli, you're going to see B lines. And B lines typically extend from the top of the screen all the way to the bottom. And pulmonary edema, you typically want to see two B lines, two or more B lines on your view on each side to kind of classify a B profile. You can also look for pulmonary edema in other parts of the chest. This is done by kind of going more lateral to your initial placement over the anterior chest. So as you go down and looking at other segments of the chest, after you're done with one side, you move on to the next side.
Types of pulmonary edema: cardiogenic, pathophysiology, caused by rapid transudation of fluid into lungs, secondary to increased pulmonary pressure without time for compensation of pulmonary rate. Diagnosis: history and physical exam, echocardiogram, treatment, supplemental oxygen, diuretics, morphines, vasodilators, and positions. See patient upright. Non-cardiogenic edema, pathophysiology: axillary capillary membrane becomes damaged and leaking, resulting in movements of proteins and water into interstitial spaces. Diagnosis: history and physical exam. Management: the initial management of pulmonary edema, irrespective of the time or cause, is supporting vital functions. Therefore, if the level of consciousness is decreased, it may use it to tracheal intubation, mechanical ventilation to prevent airway contact.
Hi, I'm Dr. David Boyle. Today we're going to talk about pulmonary edema. Pulmonary edema is a disease where the lungs fill up with fluid. We have a patient in the hospital right now with pulmonary edema. The nurse described it as a sponge. If your lungs are a sponge, normally the sponge is dry. However, if that sponge is totally saturated with water, that's what the lungs are like with pulmonary edema. Symptoms of pulmonary edema would include extreme shortness of breath.
Thank you.